Hello and welcome back to our second podcast with myself, Faye Clayton, Infant Feeding Coordinator for Aberdeenshire and a Board Certified Lactation Consultant. Today we have Sarah Boslem joining us today to talk about the antenatal visit and the importance of this visit. Sarah, would you like to introduce yourself?
Hi there, I'm Sarah Boslem and I am health visitor and also team leader for the Aberdeen City South Pink team.
Thank you for joining us today, Sarah. Can I start by asking you when the antenatal visit should take place and how parents are normally informed about this contact, please?
Of course, yeah, the health visitor generally should send out a letter to the parents, usually before the mum is about 32 weeks pregnant. This is as per the health visiting pathway. This is usually the first contact by the health visitor, unless they've met the family before, and they are introducing themselves to the family and offering a visit which should ideally take place between 32 and 34 weeks.
Okay, brilliant. And why is the antenatal contact such an important contact to carry out within the health visiting pathway, Sarah?
Well, the visit is an ideal opportunity for the health visitor to meet the family and also inform them of the role of the health visitor. For some families, this will be the first time they've ever had any contact with a health visitor. They might not know what we do, so again, we can have this chat with them without the distraction of a newborn baby. And also, parents tend to be more receptive to receiving and retaining information, as lack of sleep is not quite an issue yet. The health visitor can share public health information and guidance to promote positive attachment and health and wellbeing. We also encourage dads to be present at this visit because this can enable the health visitor to engage the dad, making it a much more positive experience for him, because if we see him prior to the birth, maybe we can alleviate some of the fears that he might have. And it's also helpful for us as well to compare the relationship between parents before and after birth. The visit helps prepare parents for parenthood and to develop and build therapeutic relationships with mum and the family. Also, we like to commence the early assessment of maternal family health and wellbeing, and also the early identification of any vulnerability or additional needs. Other things that we look for during an antenatal visit is promoting attuned, sensitive parenting, which leads to a strong parent-child attachment and bonding, raising awareness of the value of and benefits of talking, stroking and singing pre-birth, and the benefits on brain development and parent-child relationships at this crucial time. We also want to promote the importance of the involvement of dad, as I said earlier, in parenting and in their child's health and development. The visit should be led by the parents, sharing information when we can, tailoring needs around parents' needs.
And so what are some of the key areas that may need to be discussed when staff are carrying out this antenatal visit?
I would say that the most important information to convey to parents at this time is probably around safe sleep and SIDS. This is a time you'll find that when parents are very receptive to digest as much information as possible regarding their new baby, and this is a time that the health visitor should really take advantage of this, because once the baby's born, they really want to just talk about baby. Other key areas are obviously infant feeding. We want to chat to the parents about any choices they may have regarding feeding, skin-to-skin contact with both mum and dad, discussing the benefits of breastfeeding for both mum and baby. We also want to assess and support a parental plan for infant nutrition. If they prefer to feed baby with formula, then we discuss equipment they may need and ensuring a non-judgmental approach. Other areas to discuss are abusive head trauma, which also we used to use the phrase shaken baby syndrome, smoking, domestic abuse, and if the environment is appropriate for bringing a newborn baby into, such as ensuring that they've got no money worries, that they've got all the equipment for baby, etc. And also if they have got any finance problems, raising awareness of financial services that are available for them.
Okay, brilliant. Thank you, Sarah. And are there any resources that we should be taking in to help guide these conversations and ensure that parents have all the evidence-based information that they may need?
Yeah, there's loads of resources out there. A lot now that we still give out leaflets, but of course there's so much online now. I know that at every visit that we encourage parents to look at the Parent Club, because there's so much information on there. All health visitors now are trained in the Solihull approach, so we can also signpost parents to that. And of course we've got the code that tartan that we give them, that they can access the apps free. There's Icon, which is something new for us that's been rolled out in May, so that all health visitors in Grampian will have carried out training programme on abusive head trauma. And UNICEF baby friendly, and the Off to a Good Start book that the midwife will give out when mum is pregnant.
Yeah, and they're great resources for families to start reading before they have that baby. And so following on from this antenatal visit, how would staff then be recording this visit and the information that they've shared?
So in NHS Grampian, the antenatal visit would be recorded on the Morse record. This is our electronic record. This would include completing a scenario where the health visitor would record all the key points mentioned.
And we obviously know the importance of building that therapeutic relationship with our families that we're working with. Can you tell me though, Sarah, what are the benefits to that professional? What might they gain by carrying out this visit within the health visiting pathway?
I think one of the main benefits for the health visitor and for the family is relationship building. That the health visitor is promoting their role and gaining trust is the gateway to assessment. If we can gain the trust of the family in the very beginning, in the very early days before baby comes, then it's lovely for mum and dad when we come and visit afterwards, as we've already met them prior to the primary visit. Opportunities also to use experience gained from perinatal mental health training. We can discuss brain development and attachment. There are some little short videos that we can show parents or signpost them to, especially about brain development. The dads in particular really seem to enjoy that, just finding out a bit more about their baby in utero and what's going on in their brain. Also, as I said earlier, Solihull training, we can signpost parents to that as well. I would say that communication with the midwife is really important. We don't want to, duplicate any information that is given at this visit, although we do want to duplicate certain things, such as obviously safe sleep, infant feeding. But I know that I had a chat with a midwife prior to doing this, and they said that actually the information they share is quite different to what we share, so I wasn't too concerned about that. Also ensure our regular HPI meetings, which is discussing the families that are coming onto our caseloads and if there's any additional concerns, etc. The antenatal visit may also reduce the time required at the primary visit. Obtaining information from the parents, that's something that we can do quite a lot of at the antenatal visit, so that's quite helpful. Parents have said to health visitors that they really like to see a familiar face after the baby is born, and also although this is something that in pregnancy I think women don't think, but it's not about the birth, it's about the baby. So I think in pregnancy it's hard to imagine life after birth, but it's quite nice for us to have that opportunity to tell them a little bit about how life will be once baby's here.
That's brilliant. Thank you very much, Sarah, and thank you for joining us today. And again, hopefully this has been beneficial to our listeners today, and stay tuned for our next podcast in the series. Thank you.